Misdiagnosis is one of the primary reasons why pain can persist at times. We'll talk a little bit about that. Sometimes it pertains to the fact that we get anatomy centric, or we get focused on the anatomy. I'll describe that in 1 second. We also have an inflammation focus. So that's common. And many times we hear the word pain and we almost infer that it implies that equals inflammation. Oh, my back's inflamed. But there's some differences about pain that we should be careful about that. And then we get too focused on the local area where our pain is. Now, we want to be focused, of course, on that area. So if my shoulder is hurting, as a clinician, I'm going to look at that shoulder. I need to expose that area and have a look at it as it moves, what happens. But to look only at that area can lead to some problems, can lead to some misdiagnoses. The second reason is mismatching of treatment. So we can have the right diagnosis, but if we don't match the treatment to that diagnosis, we're going to miss the mark in terms of finding relief. So we tend to throw a cookbook approach at this. We'll also tend, in terms of mismatching, go toward passive treatments versus active treatments. And there's some reasons why that's less effective and why that might contribute to why a person's pain persists. And then finally, there's miseducation pieces. And the predominant miseducation piece that I see a lot is avoiding pain altogether. Now, I get it. Nobody likes to feel pain. We don't want to do some movement that hurts, but there's a reason why on some occasions we need to move into the pain. We'll talk about that momentarily.